Hello, my name's Bobby. I'm going to be doing my presentation on spinal meningitis. So, spinal meningitis is infection causing inflammation in your meninges or the membranes that surround your brain and spinal column. So, this is going to cause things like high fever, headaches, and a stiff neck is very common with meningitis. Other things that it can cause are weakness, drowsiness, and odd behavior. There's multiple types of meningitis, and which type you get is going to decide how serious it is and the way you treat it. The types are going to be viral meningitis, bacterial, fungal, and then there are some types that can be caused by cancer or other viruses. Most people that get meningitis are going to be little kids who don't have fully developed immune systems, old people, or people who have immune disorders like AIDS, and then sometimes in places like college dorms where there's crowded living conditions, meningitis can be spread around. So the most common type is going to be viral meningitis. It's contracted through breathing respiratory secretion, so coughing or sneezing, and it lasts about a week. Is not super serious. It's going to cause that fever and stiff neck, but it's going to typically be resolved on its own, or with normal fever treatments like fluids, bed rest, and then Tylenol can help with the fever and pain. The more serious type is going to be bacterial. Bacterial meningitis has about a 50% mortality rate, and can cause lasting damage like brain damage or cause seizures and other stuff like that. And the main thing is going to be getting it quickly diagnosed and get some antibiotics to be treated. With a lot of the times it's going to be babies or young children getting it. You really have to watch out for that weird fever that won't go away, and then like stiffness in their neck or back. The fungal and other types are going to be rare cases, and then they're treated specifically to like with antifungals to treat fungal, and then cancer is obviously a bigger problem in and of itself. To prevent meningitis, you're going to want to practice good hygiene, just washing your hands, avoiding sick people or people in crowded places, and that's about all you can do with it. That's all my information that I did my research on. Thanks.